Not all aphasias look the same. In fact, one of the most common ways to categorize them is by how fluent a person's speech is. Today, we'll break down the difference between non-fluent and fluent aphasias, list which types fall into each group, and explain why this classification matters. Let's take a look at a side-by-side comparison. On the left, we have non-fluent aphasias, and on the right, fluent aphasias. I should note that there can be considerable variability, and a type of aphasia may not meet all defining characteristics and still fall within a specific category. First, speech output. People with non-fluent aphasia produce very little speech, and it's often slow and effortful. In contrast, people with fluent aphasia may speak a lot, and their speech flows smoothly, even if it doesn't make sense. Next, grammar. Non-fluent speakers often omit grammatical words like is or the, a problem called agrammatism. Fluent speakers, on the other hand, use proper grammar, but their sentences might be full of unrelated or incorrect words. Then we have comprehension. Here, I wrote it the way most books tend to explain it. Basically, in non-fluent aphasias, comprehension is usually better preserved, while in fluent aphasias, comprehension is impaired. But I don't fully agree, and this is one of the problems with this classification. It groups together many different types of aphasia, which creates confusion. For example, global aphasia is classified as non-fluent, but comprehension is severely affected, probably the most impaired of all. So, don't rely too much on this. Anyway, another point, awareness of errors. Non-fluent speakers often know when they're making mistakes and can get frustrated. Fluent speakers may not realize their words are incorrect or meaningless. Finally, brain location. Non-fluent aphasias are usually caused by damage to the frontal lobe, like Broca's area. Fluent ones are linked to the temporal or parietal lobes, including Wernicke's area. So while both types affect language, they do it in very different ways, and the brain damage behind them also tends to be in different regions. The types of non-fluent aphasias are Broca's aphasia, transcortical motor aphasia, global aphasia, mixed transcortical aphasia. The types of fluent aphasias are Wernicke's aphasia, conduction aphasia, transcortical sensory aphasia, anomic aphasia. So, how helpful is this fluent versus non-fluent division, really? On the one hand, it's very useful as a first impression. It gives doctors and therapists a quick way to describe what they're seeing, and to guess what part of the brain might be affected. It's simple, intuitive, and often matches the location of the brain lesion. But, and this is important, this classification has real limitations. First, some aphasias don't always fit neatly into a category. One example is conduction aphasia, which is classified as a fluent aphasia, but can sometimes be so effortful that it resembles a non-fluent aphasia. Also, aphasias can change over time. For example, Broca's aphasia might evolve into a more fluent type as the brain heals. And last but not least, there is a lot of variability within each group. For example, global aphasia is non-fluent, but patients still have major comprehension problems. Or conduction aphasia is fluent, yet patients are aware of their errors. In short, it's a useful starting point, but not the whole story. If you want to learn how to classify them in more detail, you can check out these videos to learn about every type of aphasia that exists.